Hi, good evening, everybody. I'm so happy to see this crowd here today. I think this is an amazing event, and hopefully I can give a little bit of knowledge or shine some new facts on a few gems related to antepartum and postpartum care. So when I tried to think about how to present today, what I did was I kind of picked up on some things that sometimes when patients come into my office, some new information that I give them, maybe some new pearls that have come out, and things that could hopefully help anyone who's about to be on this journey or know somebody who is going to embark on having a baby. Perfect, thank you. So one of the first questions I typically get asked, actually a lot of times by friends and other people I meet in the community, is when I have a baby, what are my options for who will take care of me? So it's interesting that I think a lot of people don't know that you do have 3 different options, but that these options are typically mutually exclusive. So you have an obstetrician, that would be like myself, somebody who's gone through obstetrical training and gone through a residency and they are an MD. Then you have a family practice obstetrics doctor. So they would be kind of like your family doctor that takes extra training that can also deliver babies. And they do come to L&D and they have a whole practice that works side by side to obstetrics. Then there's the practice of midwifery. And unfortunately, I was hoping to have a midwife colleague up here with me today, which would have been great because the way in which they practice is quite different from obstetrics and family practice obstetrics. I'm a midwife, and I think the big difference, and again, it would be nice to have one of them here to say so, is that the midwife actually sees you through from the care of the time when you're doing antepartum care to the care of your baby, and will actually see you at home the next day. That's different than the other 2 practitioners. So this is also something that I think is very important for all of us to know, kind of, again, anyone who's about to embark on pregnancy. So this is the concept of baby aspirin. So I think we mostly know baby aspirin to be used for people with heart conditions, but what we actually use it for quite often in obstetrics is to help protect against something called preeclampsia. Now, preeclampsia is a condition that can happen to a lot of women. Typically, we see it peak closer to the end of your pregnancy, where it involves having high blood pressure and leaking proteins into the urine. And so it has a lot of complications that can be associated with the pregnancy, delivering the baby, a small baby, having an early baby. So something that we really tried to prevent as practitioners. So there's a few reasons why we want women to start taking baby aspirin earlier in their pregnancy to help prevent preeclampsia. And it's actually a very interesting list that when you look at it, I actually find reasons for my patients not to be put on baby aspirin versus the other way around. So if you look at something like, I don't know if you guys can see, line, where it says moderate. So if you have 2 of the things under the category that says moderate, you should be on baby aspirin. So if you look at, for example, being a mother above the age of 35, and then a nulliparity means you've never had a baby. So if you've never had a baby and it's your first time and you're 36 years old, like we know a lot of women are, you should be on baby aspirin. And I think the interesting part about it is typically baby aspirin, the best time to start it is quite early in a pregnancy. So even before you get to, typically before you get to any of the practitioners I talked about, most women should be started on baby aspirin. So you'll see other things there, like a family history of preeclampsia, your mother and sister. And then this is also interesting, socio-demographic characteristics. So being of an African race alone, low socioeconomic status are all reasons to be started on baby aspirin. This is another real big gem that I try to harp in my office. So this is pelvic floor physiotherapy. So this is actually a very interesting specialty or area of physiotherapy because it's a practitioner that specifically took extra training only to concentrate on the pelvic floor. And they are really amazing and very helpful practitioners. So what they'll do is they will do exercises that help with pain in pregnancy. Unfortunately, a lot of women have pelvic pain, they get sciatica, things that they can't actually take medications for. So physiotherapy is actually the only and probably the best treatment that we have for something like this. So what we do is we give a referral to women while they're still pregnant to go and see the physiotherapist. They'll also help you with kind of techniques that can help you during labor, breathing techniques, bouncing on a ball, things like that, and ways that your partner can also be involved in your pregnancy. So they're wonderful. They also protect against something called prolapse. This comes way later in the life cycle, but it literally, I don't have a nice way to define prolapse other than all of your organs fall down through the vaginal canal. It's not a wonderful thing, and it is quite common, and a lot of women don't talk about it or know about it until much later in life, and going to pelvic floor physiotherapy can actually help prevent this, as well as it can help prevent urine leakage, bladder issues. All of these things come from bearing children or several children, that this can actually be very preventative. Okay, so vaccinations. This is also a big topic that I talk to a lot of my patients about in the office, because this is something that can help not only moms while they're pregnant, but also newborn babies. So there's a list of vaccines that we talk about during pregnancy that are quite important. The first three, so the flu vaccine, Tdap, which protects against whooping cough. The P is the pertussis for whooping cough. And then now most recently RSV. So these vaccines can be given during pregnancy. The flu mostly to help protect mom, and I know some people choose to get a flu vaccine, sometimes they don't, but I think what a lot of women don't know is that if you get the flu when you're pregnant, it's much different than getting a flu when you're not. You can get much sicker, end up in the ICU, that kind of thing. Kind of similar concepts to COVID and being pregnant. You got it while you're pregnant, you get much sicker. So we always encourage women to get the flu vaccine. Pertussis helps to protect newborn babies against whooping cough, which is really bad for a really small neonate and can really damage their lungs. So we encourage patients to get that. And then RSV is a newer vaccine, so it can be given to both mom and baby, but we talk about it during pregnancy because you have the option to get it at that time. The last two, my baby is also here. The last two are chicken pox and the rubella vaccine. So we screen women in pregnancy for these two vaccines in hopes that if they find that they're not immune to these two things, that they will get the vaccines after they deliver. So it's just kind of a point in which a lot of healthy women wouldn't go through the medical system until they're pregnant. So it was decided that this is a good time to find out if you're immune to those two things. So this is just my slide on postpartum care. So I think what I wanted to add or say about postpartum care is that postpartum is a very difficult period for a lot of women, and I think it's a period that we don't talk about probably enough, and the things that can happen during that time. Now, a lot of women have a lot of family support. Some people have family members that come move in with them. They have local family, but not everybody has that. So I just wanted to talk about some of the other options that women have. So I talked about the midwife. Typically the midwife, and I believe I am correct, will come to your home the day after the baby is born to kind of help support you in that way, give you some pointers, help with breastfeeding, so that care is there. A postpartum doula. So a doula is something also that's a fairly new area in medicine. And so what a doula is it's actually defined as a labor support person. So a doula doesn't actually have any medical care related to the pregnancy. So they won't check your cervix. They won't labor with you at home like a midwife will. But what they do is add to the support network while you're laboring. It's actually interesting because having a doula or a support person at labor is actually a very good predictor for women having a natural or a vaginal delivery, because they have that extra person to support. So they're a great person to have on board, part of your team. Not easy to find, but they do exist and they're very helpful. A night nurse, so if you have the ability to hire one, that's another thing that helps a lot of moms. And then Healthy Mothers, Healthy Babies is a great resource that we have in Durham, where they'll actually come and support, and usually they're kind of flagged, or patients are flagged from their actual obstetrician or maybe at the hospital or by social work, or they'll show up at the mother's house and help with different things like, again, breastfeeding, young moms, maybe people who don't have as much family support, and they'll come and help you there. And then a lactation consultant. So this is also a very, very excellent resource that we actually have at Lakeridge Health, and we have a very, very great group of lactation consultants. So I think we have maybe at least 2 at each site for where we have labor and deliveries in Durham. And what they'll do is they'll help you if the baby's struggling with latching or milk letdown, and they're great because sometimes some of the stuff that happens with breastfeeding doesn't happen in the hospital, it happens when you get home. So they're actually great and helpful there. And then mental health. So that's another huge one that we tend to kind of leave to the wayside, unfortunately, a lot in postpartum. We know that probably 90% of moms will struggle in that first 4 to 6 weeks, but it's sometimes some women need extra help afterwards. And so, you have counselors, you have networks that provide free mental health support, and then we do have psychiatry that sometimes specializes in perinatal health. So we always advertise or ask our patients not to stay at home and let things simmer, because it can become very difficult with sleep deprivation, newborn baby, and other things that you have to manage. I think that's my last slide.